My name is Marcia, and this is my informative speech. During our lifetimes, we've all heard stories about married couples passing away within days of each other. We've heard the surviving spouse soon followed due to grief. Have you thought about what actually happens from a medical perspective? Did the surviving spouse die from a broken heart? Broken heart syndrome, also known as stress cardiomyopathy, is a real medical condition that can affect anyone who experiences a stressful event, such as the death of a loved one. I've worked with cardiac patients for many years and have noticed an increase in the diagnosis of broken heart syndrome over the last decade. Your heart can break from a broken heart. Today, I will discuss the most common cause, diagnosis, and treatment for broken heart syndrome. As this is a recently recognized diagnosis in the United States, first let us look at the most common cause for the condition. It is unclear as to all the factors that play a role in broken heart syndrome, but stress is at the top of the list. In a 2015 ABC News interview with Dr. Schechter, a cardiologist at the University of Maryland St. Joseph Medical Center, he describes broken heart syndrome as a heart condition where people can suddenly, under conditions of stress, develop severe heart dysfunction, and their hearts become profoundly sick within a matter of minutes to a few hours. A 2012 Wall Street Journal article interviewing Dr. Wittstein, a cardiologist at Johns Hopkins, who is actually studying stress cardiomyopathy, describes that it occurs from surges of stress hormones when a person experiences an emotionally or physically stressful event, stunning the heart muscle. There are wide ranges of stressful events that can trigger broken heart syndrome. I've personally cared for patients whose stressful events were due to asthma attacks, arguments with loved ones, domestic violence, and even car accidents. Dr. Schechter offers an example of a woman who experienced stress cardiomyopathy because of a public speaking engagement for work. Both doctors agree postmenopausal women are more at risk for broken heart syndrome. The cause for this is unclear, but nearly 80% of the cases fall in this population. Next, let us look at how physicians diagnose broken heart syndrome. Initially, it is difficult to diagnose, as symptoms usually mimic a heart attack. The National Heart, Lung, and Blood Institute website regarding broken heart syndrome, last updated in 2014, says although the symptoms are the same, what is happening to the heart is very different. As a heart attack is caused by a blockage of the artery supplying the heart muscle, broken heart syndrome affects how blood flows through the body as the heart muscle is too weak to pump normally. Dr. Selska and 3 colleagues report in their case study regarding the condition in 2013 in the Archives of Psychiatry and Psychotherapy, there is no one test to diagnose the condition. However, it is diagnosed by eliminating other medical conditions such as a heart attack. Their case study also states you confirm the diagnosis when the heart muscle starts regaining function within several days, as the condition is temporary with treatment. The Wall Street Journal reports experts estimate 1% of men and 7% of women with suspected heart attack actually have stress cardiomyopathy instead. Finally, let's talk about how you treat broken heart syndrome. With treatment, a broken heart will heal, regaining its full function. Dr. Selska and her colleagues report current practice is treating the symptoms, allowing the heart time to recuperate. The heart dysfunction improves dramatically in several days and fully recovers in 4 to 6 weeks. According to Dr. Schechter, treatment is much the same with medications as for a heart attack, but he also recommends stress management. In closing, I will summarize what I would like you to remember about broken heart syndrome. Although all the causes are unclear, it often occurs after a stressful event and usually mimics a heart attack. The heart muscle becomes profoundly sick, but with treatment will likely make a full recovery. Your heart can break from a broken heart. Let us remember Dr. Schechter's example of the woman who suffered from stress cardiomyopathy because of a public speaking engagement. My hope is that research quickly develops prevention strategies, as many of us taking this class often feel stressed about it. We should not sweat the small stuff and hope that our hearts can handle the surges of stress hormones during events we cannot control. I will present my card.